Hello, everybody. This is Cole from the American Journal of Healthcare Strategy, and we are joined by an ambulatory operations expert. Abby, why don't you go ahead and introduce yourself and your role?
Yes, thank you, Cole. I am Abby Berkes, and I'm the administrator of ambulatory operations at Lehigh Valley Health Network in Lehigh Valley, Pennsylvania. And I'm excited to join you today.
We're so happy for you to have us. We know that, I'm with Jefferson, of course, and you're with Lehigh Valley Health Network, and there's been lots of talks of us merging together. So I was super excited to sit down with someone from that neck of the woods and just kind of go over their career and talk about what they do. As you mentioned, you're in ambulatory operations. I started off in ambulatory specialty care. So I'm really interested to learn about the operations side of things. So can you just kind of explain to us, like, what is ambulatory operations?
Yeah, so ambulatory operations is really your outpatient setting. So it's any service that isn't taking place on the inpatient side. You don't have to be admitted to the hospital for it. It is, I think, going to be a little unique depending on the health system and how it's set up and operated in terms of structure in the organization. So for me specifically, I oversee multiple departments, smaller departments within the ambulatory setting. Within Lehigh Valley, our structure from a leadership perspective, an ambulatory includes various outpatient departments, rehab, imaging, breast health services, our occupational medicine program, home health, sleep labs, things of that nature. So depending on the system, what falls under that might be different. I am personally responsible for our occupational medicine program and workers' compensation, our sleep lab department, our endocrinology testing centers, and our durable medical equipment. So again, there's a lot of variation there, but it's really the outpatient departments that are supporting the larger hospital system on the inpatient side for those services needed, whether you need to get your MRI or your CT or have additional rehab outside of your inpatient stay.
But that is a lot of responsibility, and it sounds quite complex with all those different, parts of the organization that you're kind of dealing with all the time. How did you get your start in this? How did your education prepare you for where you are now?
Yeah, so I went to school for business and I recently just finished my master's and I went for my master's in business administration. And so I started out actually on the employer side. And so I actually went through a management training program and it taught me every kind of different element of the employer space. And in that world, it was employer production and manufacturing. So and it was a different side of the spectrum. When I finished that training program, I had the opportunity to move to the clinical side. And so that's where I moved to the Philadelphia market, went and started working with Concentra in the clinical space, and was overseeing clinic operations. And operations is operations, right? You can be plugged and put into kind of any different space, understanding that there's a service to deliver and we have to figure out the best way to deliver that service through process management, people management, and figuring out making sure that your P&L is strong. So when you
Mhm.
take it all apart into its various segments, operations is just learning the product. What do we need to deliver? What does the client expect us to deliver? And how is the best way to deliver that? And we just continue to evolve that process. And so when I moved to the clinical space, it was not expected. If somebody would have asked me 25 years ago where I'd be today, I would have never been able to guess this. But it's really understanding what we're trying to do. And so as I continued to grow in the clinical space, I saw the importance and the need for it. And I love the operation side. There's always something to potentially fix. Not necessarily bad. It could be small and it could be major. It's just staying ahead of the curve of what's the next part to come. How is there going to be a new product or service? Is there going to be new equipment or technology? So it's really staying ahead of that. As I continued to get further into healthcare, I had the opportunity to move closer to home as I was starting to raise a family. And I joined Coordinated Health and started to oversee their occupational medicine and urgent care program, which had been a lot of my career. So again, it was process improvement. How do we look at the service we're trying to deliver and what are our challenges and barriers? And it usually was very small, minute things. And it was just really educating our teams to know how to best deliver that care. And so growing and learning and taking on every opportunity. I was never the person that said, nope, don't have time for that. I always took on every opportunity, and my team and my mentors always knew I needed to be challenged. So when they had these little projects that was completely outside of my scope, I was like, hey, Abby, how do you feel about this? Sure, no problem. Let's figure it out. Because again, if you take off the layers, it's just an operational process. So I was always kind of that go-to person of ask Abby and see if she can handle it, or let's talk to Abby, bring her in and see what thoughts she has. So I kind of became that go-to person, and it just gave me exposure. I just wanted to learn. And I didn't actually finish my MBA until recently. So throughout all of this and the growth of my career, I didn't have my MBA. And it was always something
Mm,
I knew I was going to do. But I finally got to a point where I felt the disconnect. I was like, I'm sitting in meetings and I felt the disconnect from a dialogue, from a process and a thinking standpoint. And I said, now is the time. Now is when I need to do it, because I felt the need where I had to in order to continue to progress in my career. So there was nothing that was really planned in how my career spanned and from then until now. And so as then Coordinated Health was purchased by Lehigh Valley, at that point, I had also gained basically all of the non-orthopedic service lines. And then it was integrating all the service lines into Lehigh Valley, which is a very significantly larger system. We had
mm,
departments of 3 and 4 providers folding into departments of 40. And so, again, it allowed me to learn that system. It was also in the heat of COVID, which presented additional challenges. So, it's just the constant learning and wanting to engage and understand and giving yourself exposure. It is really
mm.
kind of how I got to where I am. And so I'm in this position now where we've fully integrated with Lehigh Valley and really just kind of expanding departments and saying, okay, so now we are looking at evolving our durable medical equipment or continuing to integrate some occupational medicine programs or expanding those programs. And so it just kind of came naturally and organically of how I've evolved into having some of these roles. But it's really just a lot of the departments are kind of set up, and we've done the process. We've rolled out the same things across the board for all team members. And when you have your team set up for success, they know what to do and they know how to do the job. So then when I'm presented with another opportunity for a department or a project, I can say, yeah, my team is good to go. I can move into this direction. So I've been blessed with great mentors that have given me those opportunities to be where I'm at. And I just didn't really ever say no, which I don't know if that's a great thing or
I think
not,
that's
but
excellent
definitely
advice.
give me the
That is great
exposure
advice.
that I needed. So
Yeah, that is excellent. It's especially for all of the fellows out there. I know we have a lot of fellows that watch. To never saying no to that project, I think is excellent. That's a really good advice. With everything that you've gone through and where you're at now, what does your day to day actually look like? Like, what is it like when you get in the morning? What are some things that are you like you're doing throughout the day?
it's at different every day. There's some days where I'm in back-to-back meetings. There's days where, my schedule as of 5:13 on March 5th for tomorrow as it stands, it will likely change by 8 a.m. tomorrow. And as operations leaders, we have to be okay with that. We have to be okay with that transition and know how to make those shifts. And having done this for as long as I have, it's kind of natural and expected that that's just the organic play of your week. I do have days where it doesn't change. It's rare. But there's a lot of just meeting with my teams and understanding what challenges they're having and working through their day, just checking in to see how things are going, what volumes look like. We just got through budget season, so there was a lot of financial meetings, but it's a combination of client meetings. We have vendor meetings where we're constantly looking at potential new equipment, new client meetings on the employer occupational health side of who we're meeting with. Tomorrow, I'm actually going to tour a major employer in our Hazleton market. So it could be a site tour to visit our teams, to say hi, see how things are going, answer their questions, but be visible and have those relationships with our front line. That's the most important part. I don't ever want teams to think that the decisions that are being made are from somebody that sits, in an office somewhere that doesn't ever see what's in front of them. So I have always made it a point to be front and center with those teams, knowing them by name, who they are, what they do every day, and understanding that challenge. So when they say, I have this issue with the system, I know exactly what they're talking about. I'll stand right next to them and we'll walk through the process. Show me what's happening when this happens. Anytime I've ever taken on a new role, I've found it very important to sit with every member of the team. So, for example, when I came to coordinated health, I'd been out of the health space for a couple of years, and I sat at the front desk for about a week. And then I went and sat with the billing team. And then I went and sat with the sales team. And I wanted to understand from point A to point B to point C, what does it look like for the patient? How does it look? How does it feel? If when this happens, how does it flow? Because the only way we're ever going to be able to evaluate a process, and even if it's not broken, I have to understand what the team is talking about when they represent their challenges. So I tried to make it a point to spend as much time with our frontline teams as possible. I can do my meetings from almost anywhere. COVID was great in that it taught everybody to kind of work remotely and differently. And so I can take a meeting from anywhere. I can be in the car. I can sit in an office somewhere. I can find an unused patient room somewhere to go take a call. It's important for the frontline teams to see us. And when you build that relationship, you're able to build trust, number one. They respect the decisions that you make, whether they agree with them or not, at a higher level. And it builds that rapport. So, my day-to-day could be anything from client meetings, market research, data analysis, staffing and interviewing, collaboration with our other teams. We're a very large system. We have a lot of engagement with those teams. So it can be a number of those things. And, some of my favorite days are the ones that we spend all day with clients and talking to our frontline team members.
My one of my earlier mentors, she had scrubs in her office, and she kept them there. She was inpatient, of course, and she managed some surgeons, and so one of them
Right.
would be talking about a new robot or a new piece of equipment, and she just couldn't fully grasp what they were talking about until she went and just got in the room and actually saw what was going
Yeah.
on. And in Six Sigma, I'm sure you're familiar, like walk the process,
Oh, yeah.
but it's not just like
Yeah.
walk it once and then you're good. It's like daily having to see
Right.
what's going on.
Yeah.
Yeah. And the thing is these doctors and nurses, they're extremely intelligent and extremely well trained in an area that I can't understand because my mind doesn't always work in that clinical way. And so that
Correct.
collaboration in person is so important.
Oh, absolutely. And that's I think some of the biggest challenges that I've encountered being non-clinical in the clinical space. And I get very honest with the doctors that I work with. They say, I'm not a doctor. I need you to explain this to me as if I'm a patient, so that way I understand what you're talking about. But it also levels sets with them. Like, I'm not trying to be a doctor, but I need you to help me understand what's working for you and what's not, because I don't speak the doctor language. It's just not something I'm capable of doing. And I don't want to take over those clinical decisions. That's not the career path I chose. I can barely take my own blood pressure with an electronic cuff, let alone try to help them out clinically. So, that was one of the biggest things I was very humbled by, of an early leader that I had, of you building that relationship with those physicians is one of the most important things you're going to ever do. And it's because they need you to help run their practice. They don't need you to help see patients. They need you to help run your practice so they can do the best care that they possibly can. So, it's funny that you bring that up, because that was very, very clear for me as well. I don't need to jump into this clinical space.
I was a pre-med originally, and I would be failing a chemistry course, and I'd say, well, I'm just not smart enough for medicine. But then when we go into business school, some of my medical friends have a hard time with the business classes. And so it's just the
100%.
different ways people, they find the things that they're good at. But
Yeah.
shifting gears for a minute, how long
Yeah, of
out
course.
are you making these plans for the clinic? Is it years, months, 10 years, 5 years? What does that look like?
I mean, we always continue to look, you know, 3, 6, 9 months, 5 years ahead. Healthcare is changing. There's no secret sauce to it, but we can take a look at the trends. And so When we're doing business plans, we make projections and we take a look at what this could potentially look like. Obviously, business planning with acquisitions and mergers and things like that. So we always want to be aware of what's coming down the pike and understand how Medicare and Medicaid, what they're doing. We know commercial payers tend to follow suit. But, part of how we have done so well as a network was our leadership is continuously looking that far out, and making really smart business decisions about how things progress. And, one of the big testaments is I remember one of the first leadership partner meetings that we had with Dr. Nestor is he was talking about what's going to be happening with Medicare and Medicaid 3 to 5 years from now. This was a couple years ago, and you see it now play out. And we're like, yes, we've talked about this. We knew this was going to happen, and here's what we did to prepare. And so I feel very grateful that we have a really strong leadership team that makes those decisions and looks that far ahead, and then we follow suit at the practice level. And so, because of those decisions, we were able to open new hospitals during COVID. While other systems were shutting down and doing things, we were able to open them. And so we absolutely look as far ahead as reasonably possible. It just kind of depends on what's trending for those service lines at that time. And those things get derailed. We know that. But when you already have the overarching plan, it's easier to go in and shift and say, okay, this happened. Here's where we need to shift and adjust. Instead of saying, okay, well, this happened. Now what? Right? We're already prepared mentally and have those plans kind of mapped out in a generalized area to know this is what we expect and here's a potential impact.
How did you learn how to do that? How did you learn how to think strategically like that?
I've been blessed with some really great mentors. I have to be honest. One of my first mentors, a gentleman by the name of Mike Ryan, who hired me at Concentra, was always very strategic and taught me how to evaluate financials. We learn how to do math in elementary school. My kids are learning it now. 2 + 2 = 4. But it's what's behind the numbers, what drives every single one of those elements. And so he kind of taught me how to evaluate on a different scale, and then followed up with, current mentor and leader of mine at Lehigh Valley, Amy Nyberg, very analytical and dynamic. And they teach you how to look at things differently, knowing what to look at, having great analytics and data teams to ask those questions to, and know who to go to and what questions to ask, or be very vulnerable and say, walk me through how to do this. But you have to find mentors that will help guide you and understand it. It's not, you can learn some of this stuff by doing, but a lot of it is a process of understanding and walking through it with leaders that have been very successful ahead of you. We use a lot of different data analytics for what happens in the market. We can see our volumes, and we can see some dashboards from nationally ranked organizations that publish data. It's usually a year behind, but we use that to they say, okay, so here's how it's trending. This is what we can expect. We look at population data. We look at all of those different things. For me, on the employer side, we look at the shift in employment. What does that look like in this region? In this region, we're grateful because it's a very large growth region in the country for industry because of we have land and we have some very major highways that intersect. So, and it's cheaper than New York and New Jersey and the surrounding states. So we look at all of those things and put it, kind of throw it up and say, okay, how does this connect? And then so we say, okay, so here's how it's been trending and what happened during those years to create that trend. What do we expect to see? But you really have to have some great mentors to teach you how to do it. Some people are naturally great at it. But I think when you have people that challenge you and being okay with people challenging your thinking, that's when you really become a great strategic thinker, because we are all built differently. Our experiences have created the questions and the path that we take. And so we have to, as leaders, also be vulnerable to say, I don't have all the answers all the time. And I need to be okay with people questioning my thinking because it's actually making me a better leader.
How did you find these mentors? I mean, it sounds like they've had a huge impact on you. How did you discover them?
I think it's very important to also interview the people that are interviewing you. I have always felt connected where I've had jobs where I've interviewed hundreds of different places. And I think it's very important that when you interview, you need to come out of that feeling as good about it as the interviewee did for you. And if you don't pick those people, you need to have somebody that you can kind of ping and pong with, that you know you're going to be able to have that open and organic relationship, that they know what drives you as a leader and they are able to provide that for you. And they're looking for some of the same things. And I think that that is what has gotten me to where I am. I actually met Amy prior to even joining Coordinated Health. She was on a panel speaker at Lehigh University on a discussion around the cost of waiting for healthcare and how she described certain things at Coordinated Health at the time. I was like, I need to know her. I need to meet her. And a year and a half later, I was actually in an interview room with her, and I was like, I don't know if you met, because I of course introduced myself afterwards, and I was like, I don't know if you remember me, but I saw this talk. I was so engaged by you, and I'm so excited to be here. But it's finding those people that you connect with. It's really important. And I know people aren't always blessed to be in those positions to say, they might need a job, and that's great. And sometimes you have to take those positions, but I think it's also very important to make sure that when you're in a leadership role, you need to have a leader that you connect with that is going to help drive you to be a better leader yourself, because I do definitely think that there's something to be said for hiring strong leaders and hiring people that are smarter than you, because you learn from them. And so I think that it's very important to surround yourself by people, not necessarily like-minded, but goal focused in similar mindset as you, to be able to help drive you, because not everything about operations is glamorous. And we need to have those people that bring it out in us and say, we're going through this for a reason. There's a lot of different things that impact our day. And when you have leaders that help you find the positive in those, that's what makes you a great leader and ultimately helps to drive you to become better and have better results for your team.
I agree. I've been very fortunate with the leaders that I've had, and they really, and it all the way up the chain. Their leader is responsible for my leader's success, and so just
Yeah,
if the kind of having that community of leadership that's strong has been really
absolutely.
beneficial. I think that's another reason why I'm excited for us to join as Jefferson with Lehigh Valley Health Network, if it all goes through, is just because I've met quite a few leaders, including yourself, and it just seems like an excellent community with being able to
Yeah.
access a whole nother network of mentors will be really, really
Yeah.
exciting. So
Yeah,
I'll leave you with
absolutely.
one final question, and it's, what do you think kind of the biggest problem in ambulatory care is right now, and how are you working to overcome it?
I think it's the same challenge that every other health system in the country is facing, and it's a staffing shortage. I was actually, looking up for a paper that I wrote towards the end of my MBA, and it was this alarming statistic that they projected to be short 120,000 primary care physicians by the year 2030. And that's a scary thought, because it's not like we can engage somebody tomorrow to become a physician by then. That's only 6 years away. And so I think we continue to have to work and partner with the other hospital systems and teams and clinical teams by us to come up with creative solutions to be able to still provide care. We still have a very unhealthy environment that we live in, and the population is a very unhealthy one. It's great that people are continuing to live longer, but that just means it's a bigger population as well to serve. And so I think that we have to continue to collaborate and come up with creative solutions to want to engage people to want to join healthcare. There was a lot of people, we saw the mass exodus of COVID, of people saying, that's not a path I really want to enter. I don't want to have to go through that. But now that we've kind of come out of it and people see that there's still really strong healthcare systems and so much work to be done, and there's so much value in knowing that you've impacted somebody's life. And I think that's why, all of us as leaders in the healthcare space, that's why we still show up and do it every day. There's a patient and their family at the center of everything that we do. And so no matter how hard the decision or challenging the day, there's people at the center of everything. And those are people in our community. So we have an obligation as community leaders to do what's right and try to engage people to want to enter the health system. And so, I think that we've all been saying we need to make our country healthier for a very long time. And I don't know that we've really had success. no matter how many apps or gym memberships or New Year's resolutions they have. But I think that we have an obligation to help people understand how great it is still to be in healthcare despite those challenges. Because every organization, while it may not be COVID, has those challenges. And so it's really helping people understand that you can still make a huge impact. It's so many different levels, and we need those clinical teams to take care of our nation.
It's so true. And you're right, the pipeline, right now it's 6 years away. Medical school is 4 years, residency is 2 to 3. So the decisions we're making now, impact us for the future. And we got to be serious about it and take it seriously and just do the best we can and try to encourage people. We at the Journal, we go to these career events and try to encourage young nurses and things like that and try to give them as many resources
Yeah.
as we can. I know Lehigh Valley is really big in that as well. So I
Yeah.
really appreciate you coming on as well and sharing your insights for
Yeah, of
either the
course.
younger people getting into strategy or some of the more experienced ones who are kind of interested in it. So thank you so much for your
Yeah.
time. And I'm sure we're going to be hopefully talking a lot more as the Jefferson merges
Yes.
and whatnot.
Yes.
So thank you so much.
Yeah, well, thank you for taking the time. And, I think it's great that you're doing this and, bringing some awareness to what's out there and opportunities. And, I'm really excited and I'm sure we'll be talking soon. And, if there's anything you need, let me know.
Great. We'll be definitely in touch for sure.